and good afternoon, and welcome to this Adult Social Care Recruitment Hub meeting. I'm Simon Jones, the Director of Communications at Wesco. And for those that are new, and obviously a lot of colleagues joining for the first time today, and for those not sure what the Recruitment Hub is, essentially what we're seeking to do is establish a network where councils and other interested parties can plug into and share best practice resources, strategy insight and performance data when it comes to recruiting adult social care staff in your area. For those who don't know Wesco, we're part of Westminster City Council, and we've been helping councils improve the way they communicate for about 20 years. A big part of our role now is helping councils deliver sophisticated campaigns to overcome common challenges. Of course, adult social care recruitment is right up there when it comes to common challenges across local government. Alongside the Adult Social Care Recruitment Hub, we also have a similar network for foster care recruitment, where we've got about 100 councils now sharing best practice resources. And for more than a year, we've also been running a COVID campaign hub where 70 councils and NHS trusts are sharing strategy and content to tackle vaccine and hesitancy, because we think the approach works. We really think that, you know, by especially in this day of squeezed resources, that the kind of sharing, learning, comparing, and sometimes pooling budgets approach on common problems is the best way to drive down costs and increase performance. And hence, if you're willing, that's what we'd like to do in terms of meeting regularly to update you on the resources that are available for you and your team when it comes to recruiting adult social care staff. And there's already a lot of resources available, much of which is free. I won't be going through that today, but I will be signposting that at the end, because a big part of the campaign hub approach is sharing what others are doing. And that's why I'm pleased to bring in our first guest today, Graham Rushbrook, who is an experienced social worker and public health professional who will be telling us about Project Lambeth, which is an innovative approach to connecting people with services that they need on the ground. And afterwards, I'll also be introducing John Paul Dannon from the Council Advertising Network, who's our campaign hub partner. And he'll be talking about how to target audiences effectively online when it comes to adult social care recruitment, including some really important changes in the way that paid Facebook advertising works. So without further ado, I'm just going to hand over to you, Graham, to tell us about Project Lambeth.
Okay, so thanks for the opportunity to talk to you today. I'm going to talk to you a little bit about Project Smith, which is delivered in Lambeth. And just to start off by saying that my move to public health was facilitated by feeling a little bit limited in my reach as a social worker many years ago. So although I enjoyed social work a lot and worked in children and families and treatment centres for NCH, Action for Children, I just felt that the reach that I could afford with being a single practitioner with a caseload was quite small. So became very interested in public health, did quite a lot of work around sexual health, HIV and comms for recruiting people to behaviour change. Which brings me to Project Smith, which is a Lambeth initiative. It's funded out of something called the Better Care Fund, which is an adult fund, very limited fund in terms of it's not being used for other statutory services such as mental health or carers assessing. And it's slightly different to the programmes that some of you might be familiar with elsewhere in the country around community or health champions, where volunteers are recruited to undertake campaigns and behaviour change initiatives. In Lambeth, we decided to go for quite a different approach because, as no doubt some of you are familiar, when we tried to reach into communities, we often got the same people coming forward, and they weren't necessarily representative of the makeup of the communities that we were seeking to work more closely with. So we were invited to create a sort of good neighbour behaviour change, health and wellbeing hub through Project Smith. which has two strands. One is a programme called Community Connectors, which is how people work one-to-one, engaging with neighbours at the school gate, in supermarkets, at the library, gym, working with the homeless on the street. So really just engaging with people as and when they present, so quite opportune. And the second strand of Project Smith is a little bit more traditional, and it's a small grants programme, although the initiative has over the years evolved so that the application process is really quite straightforward, and that's meant that we've been able to encourage some very different people to apply for a small grant to run activities that are generally focused on well-being. So why is that possibly relevant to your initiatives? One of the things that we do is we train adults in behaviour change. There's a national qualification provided by the Royal Society for Public Health. We've also trained them in encouraging vaccination uptake, which is another Royal Society for Public Health qualification. And we thought initially from our performance requirements that that was all we would need to do. And we've certainly succeeded in that. We've got about 300 community connectors now in Lambeth, and we've got approximately 150 grants have been awarded over the last 5 years. What we hadn't anticipated was how many people would come to that programme with huge skill sets around being carers or indeed foster carers, social researchers. And so one of our big unexpected outcomes was just how many of our recruits we lost to paid employment. And that wasn't a measure that we were asked to deliver against at all. They still stay involved with the programme. The programme's got some, I think, quite interesting elements to it. We provide something called a safari every month. There's a picture of a safari now, and a safari is essentially where the connectors visit organisations across the borough to learn more about their offer, find out about the eligibility of the offer they make, and become more effective at signposting people into appropriate services in a timely way. So not unlike a link worker, not unlike a social prescriber, but absolutely unpaid and absolutely working of their own motivation and in their own timeframes. We have found that we have been able to support a fairly significant, so I would say 30 previously unqualified or previously unqualified with English as a first language qualification into care and not just care, into statutory services, so perhaps working with DWP. Also, we've had some success with people moving into social research and supporting the work of Groundswell, as well as people moving into paid employment in organisations like Healthwatch. So initially, it was about improving well-being. Initially, the programme was about extending the reach of services to individuals in the borough that did not usually come forward. But without really planning it, we found that when their confidence grows and they're made aware of where their skills sit really well, they're really able to move into the paid workforce really quite quickly. And one of the things that I think I've learned in the last 5 years with the programme is just what a blind spot, and I know that's not a particularly brilliant term, but what a blind spot I had about carers, unpaid carers, at being a pool or a resource for recruitment into entry-level roles in social care. And I'm pleased to say that several of our community connectors continue their role as a carer in their private circumstances, but are also now enjoying paid employment within the local authority or charities. So really that's what Project Smith is. It's been running for 5 years. It's just gone out to tender. The tender's just been awarded for a further 5 years. It's run with an advisory group, which is quite different to a management group in that it is advisory. and it's made up of local residents, steered by myself and a project manager. And we invite and have conversations with a whole range of people from different services and different organisations across the borough, just to facilitate appropriate and timely signposting, but also to make sure that people are more aware of what services are out there. So in a nutshell, I'm sorry if that was too long, in a nutshell, that's really what Project Smith is. It's possibly the nicest piece of work I've done in a 38-year career. I really enjoy it. I don't have to wear a tie to work anymore, which is a real joy. But more importantly, the people are just amazing. And if I've got a sort of takeaway point for you, it would be, it's so interesting seeing these people where employment or recruitment is not on the agenda at all, and how easily they've been able to find their way into paid work through confidence building and awareness.
Brilliant. Thanks, Graham. Really, really interested to hear about Project Smith there. And I'm kind of, I mean, I'll open it up to colleagues on the call to see if there's any questions or comments that come out of it. I guess one thing for me is that there may well be some similar schemes running in areas in local authorities where colleagues are on the call, potentially run by the third sector or other organisations, but not necessarily used not used for adult social care recruitment. And I think it's just really interesting to see how that works and the success that you've had, and probably give us all ideas in terms of how we may be able to use existing infrastructure more effectively to connect people into adult social care roles. Was Project Smith set up with that in mind at the start, or did it evolve into that, Graham?
So totally evolved. There was absolutely no performance indicator around employment or recruitment, none at all. It was about community engagement. It was about originally it was about managing long-term conditions. So it was trying to work with people who were high traffic users of the NHS or local authority services, often on a duty basis or an urgent basis. So they weren't managing their circumstances particularly well, or the system wasn't responding to them particularly well, might be fairer. Just to go back on your first point, and it's interesting you talk about Westco. I've actually worked on a similar contract in Westminster, Hammersmith and Fulham, and Kensington and Chelsea for about 12 years. It's a community champions programme in Westminster, Hammersmith and Fulham and Kensington and Chelsea. And similarly there, volunteers who end up recruited to manage programmes of volunteers. So I met with somebody yesterday who I'm delighted to say is now a community centre manager, having started off as a 12-hour-a-week volunteer about 9 years ago, moved into a voluntary volunteer coordinator role, then a paid volunteer coordinator role, then an assistant community centre manager, and now is a community centre manager. In work training, not gone off for a professional qualification, has a whole set of skills around engagement and linguistic skills that are actually really applicable and probably more pertinent. So yeah, I think it wasn't what we expected. It wasn't a required outcome. We're furiously trying to make sure it stays not being a required outcome. Just as soon as it gets put down that that's what we've got to achieve, I doubt it will be so straightforward. Yeah, so I hope that answers that, Simon.
Thanks, Graham. Just checking to see if there's any other questions. But just one follow-up for me, Graham. And what does it take to become a community connector? Are these essentially volunteers, or is it paid, or what kind of skills or attributes do you need?
Okay, so you need to be resident in the borough. One of the real innovations about the programme, I think, is that we recognise that people live in a borough and they use services regardless of their level of income or their background. So they're not paid. They have 4 days training with the qualification. They have a monthly supervision. We provide them with lunch quite often. And the services that invite us in often provide us with a small lunch or coffee and stuff. So it's a very low cost intervention. The real distinction between these people and volunteers is they're not contracted. So a volunteer will get a contract for a number of hours in a specific location to work towards a particular service. the connectors absolutely work off their own back, doing the hours they want to in the places they want to, and most significantly, we don't police check anybody, we don't DBS anybody, on the basis that they are already local residents. There are lots of skills and history and lived experience that people can bring to a role that they might find themselves excluded from if they went through a sort of quite clumsy, clunky statutory system. Having said that, being able to work with people that do have a history, perhaps a criminal history that's spent, has been really worthwhile and rewarding as well, because some of those people have been able to find a way into employment by demonstrating that they've moved on.
Absolutely. Fantastic. Good.
Can I
JP?
ask a question? If you were asked to set something like this up from scratch, what are the things that would you do differently? You know, are there any things that you do sooner? Are there any things that you wouldn't do again?
I think that we would move to a model where the connectors themselves delivered the service far more quickly. There's been some really interesting. Lambeth is a borough that has frequently had things done to its residents. And there was a lot of fatigue when we set this programme up about, oh, here we go again, another bit of money that's going to run out in 18 months, and you're going to come and do something to us, and then you're going to go and leave us high and dry again. So I think we would move people into paid roles, supporting the delivery of the programme far more quickly. Having said that, JP, the interesting issue is that the local community have been offered that opportunity on several occasions now, and have actually come back and said, no, we like it being managed. We like the fact that it's not a normal community programme where everybody's fighting to be in charge and everybody's fighting to have their little niche. You come and deliver a programme with us. The interesting thing I would set up much more quickly is the dialogue that we have with Health Watch, with the local authority. COVID for us was quite a positive experience, ironically, because the public health team and the commissioning teams in Lambeth absolutely needed the reach and the intelligence that Project Smith brings. So communicating messages out really quickly, from things like food availability, to pop-up vaccination centres, to failure to things like people not being able to get access to electricity. All of those things, Project Smith were able to respond to very, very quickly. What I would have done differently is I would never have set up a network of conversations through WhatsApp. It's quite difficult to moderate. It's incredibly intelligent and nimble. We have all sorts of questions posed by the connectors, like where can I go for secondhand school uniform? Somebody's asking, round to how can I get my elderly parent care assessed? And they answer each other with really good, solid intelligence and experience. But the WhatsApp platform is quite it's an unhelpful platform for that sort of work as well.
Brilliant. Thanks, Graham.
Thanks, Simon.
Okay, thanks. If there are any sort of thoughts or comments or questions about what Graham's mentioned, then please do post them in the chat channel, or indeed you can always email us at the end as well, and we can kind of put you in touch as well. So thank you very much, Graham. Really fascinating project, and great to see how it's really working to, as I say, to help connect people with adult social care opportunities. Brilliant. So we're now going to kind of move on to our second guest and partner, John Paul Dannon. And we know obviously one of the key requirements when it comes to recruiting for adult social care is making sure that you target the right audiences, as Graham is doing for a community engagement-led approach, but also through a digital approach as well, in terms of being able to reach people online and connect with them about local opportunities in their area. And John Paul, you're going to talk to us a bit about how that works, but also about some quite big changes, I think, that have taken place with Facebook paid advertising, because we know a lot of councils will be using paid Facebook advertising to try and target their messages and marketing online. Can you tell us a bit more about what's happened and what the changes are?
Absolutely. I'll quickly whiz you through this, but in essence, Facebook isn't going to be as big a part of our recruitment campaigns in the future. So I just wanted to be able to equip you with the communications that we probably need to prepare around this internally. So I'll quickly whiz you through what's happening, the context for these changes, the impact of that, and what we can do about it. So on the various during the various campaigns that we're running at the moment and have run in the past, Facebook is a big part of delivering, of reaching people. It's because people use that platform a lot. So it's where people are, we can put those messages. And it's been pretty good for targeting very specific audiences, generating interaction and building audiences over time. But what we're seeing is overall performance is going down. We're starting to get a lot of rejections, so ads being pushed back. We're also seeing the targeting around recruitment ads being blunted, meaning that it comes with much more inherent wastage, which makes it very hard to plan and hard to build into particular campaign plans. Why is this happening? Well, over the past couple of decades, there's been a huge shift in media consumption. 300 billion plus spent on Google and Facebook last year. This money is coming away from traditional media owners, and unsurprisingly, they're fighting back with scandal, but also with regulatory pressures and lobbying. And what they're really trying to do is to undermine the ability of digital advertising to take share away from them, basically forcing them to be less competitive. So one of these, why is Facebook changing? Well, with regulatory pressure and a lot of that scrutiny, their reputation particularly has been dragged through the mud, and they're now trying to repair trust on an individual basis with the platform's users so that you have faith in the integrity of your data that's kept on the platform and the safety measures they have there. There were big impacts of GDPR, particularly around inferred personal identifiable information. So if you ask, for example, do you have a mental health problem, or do you earn this much, it generates a piece of data which could potentially identify you. And so that's why you get some creative pushback on the platform based on messaging. But the recent change, which has really had an impact, is around anti-discrimination. The theory being that if we want to give people the equality of opportunity towards having equality of outcome, we need to recruit for roles in a much more equal way. So in terms of targeting specific age groups, income levels and locations, Facebook have actually sort of removed that ability. Once they identify that your campaign is about recruitment, it immediately gets spread to a much wider radius, and you are unable to zoom in on specific genders, age groups, and so on. So this means that when you put budget into Facebook, it's going to be much less targeted than maybe your needs are. So what's going to be happening with recruitment campaigns? We will be relying much less on the platform for it, and any recruitment campaign probably should as well, which means that we need to build in less performance. Facebook's very good at generating clicks and interaction. When we project what a campaign is going to happen in the next financial year, we should reduce that down. But there is an opportunity to improve performance, which we're really zooming in on. If you're not going to invest in Facebook, where do you go? So this is where we quickly look at some of the alternatives, a range of organic, above the line, a whole range of different potential channels that you could use. And we've scored them based on a range of facets. What proportion of the target audience can you reach? How good is that targeting? How much wastage becomes involved? The ability to achieve high frequency, so seeing things regularly, which nudges people towards taking action, and the ability to interact and the cost of interaction, and so on. And then we've organized these in the context of recruitment advertising. And so we can see where we would expect, if not Facebook, where comes next. And obviously, you can see here that search and remarketing from the public sector estate is probably where we're going to start investing that budget more. So the strategies we'll be deploying are going to be around search maximization, making sure that anyone looking for jobs, careers, job sites, so on, are seeing ads for social care roles and careers in social care. Also implementing remarketing pixels across council jobs boards, across local regional jobs boards and the council corporate site gives you an audience of people who, as Graham showed, may already be engaging in some sort of form of care delivery and are close to care. People who are close to care are more likely to progress towards it as a career option. And then for delivering the video content that Facebook is very good and Instagram is very good at, we're looking at YouTube. So using remarketing, pushing out on YouTube reaches a lot of people, and that's where we see things going. So in the hub, on the various campaigns that we're running, we'll be benchmarking these and looking at, can we reduce investment in Facebook and improve overall campaign performance? So what actions should we take when we're running such campaigns? Firstly, communicate. Tell the seniors that what you got last year isn't what's going to happen this year. Then also inform them we're going to take a proportion, maybe 30, 40% of Facebook spend, and we're going to test these alternatives and to see what happens, and bring them in on that measurement and that evaluation, so they can see it happening and they maintain trust in your approach. And then also, don't just think about your own campaigns. The brilliant thing about the hub is that you can benchmark against others. So you can see what's happening, what the industry averages are, and maybe also compare the data you're getting in terms of cost per application and so on to other similar authorities. So that in a very short space of time is what we'll be doing. Very keen to speak to anyone that wants to benchmark a previous campaign or a future campaign. We're running a lot of creative tests at the moment with other members of the hub. Hannah and the team have created these really, I think, beautiful moving portrait images, which we're currently testing in North London, and we'll be feeding data back on how those perform versus statics. We've also seen that the West Coast suite as well is performing quite well against other alternatives, sort of in-house generic creatives. And so in the next session, we'll be looking really into the data about what images, tactics and approaches generate high quality applications at scale. And we'll be focusing on that data in the next session. So that, Simon, is the end of my bit.
Thanks, JP. Really interesting just to hear about those changes in Facebook. And we've got one question from Matt from Suffolk County Council, who says that maybe you can distinguish a little bit and talk about the different benefits between, you know, the traditional perhaps approach, which may be boosting posts compared to the pure Facebook advertising. And what do you recommend?
Well, because the value of each applicant is so high for you, they're needed, and also they help save the council money. You can spend a significant amount of money reaching them using posters, out of home, radio, and so on. In terms of value for money and really reducing your cost per click, boosting posts on Facebook is really cost efficient. However, it's not quite as targeted as you might want to be. And also, the ability to boost posts on Facebook now in recruitment campaigns means it's going to be even less targeted than it was before. My recommendation before the change in the algorithm would have been definitely boost yourselves, but maybe use an agency or if you've got a really good in-house digital team for remarketing and making sure you reach the places that boosting doesn't reach. Now, I would suggest do not make Facebook the sort of central part of your campaign, boosting or general paid otherwise, and really look at experimenting with search. If you're in there, search ads are relatively expensive in terms of cost per click, but the post-click interactions and the post-click dwell times are really high, unsurprisingly, because you're taking someone who is actively looking and diverting them to you. Whereas with Facebook, it's much more about higher up in the funnel, consideration and so on. So that is what we'll be testing. What we hope to have is in the next couple of months, some really clear benchmarking data from a range of different campaigns, which will give us national average benchmarks, which you can then use to measure against what you're doing. So that is coming.
Okay, brilliant. Thanks. Just checking in to see whether there's any other questions or comments. What we'll try and do is is keep these meetings as much as we can to about 30 minutes in the future, because we know obviously time's very short, and we want to make these as informative and as condensed as possible in terms of signposting, as I say, opportunities to help you on the ground when it comes to recruitment. What we do have, and what we'll probably spend a bit more time next time on, is a ready-made adult social care recruitment strategy that we've been developing with a number of councils here at Westco. And what that's designed to do really is define very specific target audiences, people who we think could be much more interested in adult social care roles based on various factors, including their values, which is particularly important here. And then what we've done is developed a content strategy with lots of assets, social media assets, digital assets, to encourage people to find out more information, to excite them about opportunities in adult social care, and to give them the information they need in order to make an informed decision. And then what we're also working on with a number of councils as well, which is where the pooled budget element of this approach comes in really neatly, is we're working on a recruitment hub, a local microsite that councils can use that brings all that content together to enable people in your area to find out about roles, adult social care roles where they live, and also then to connect them with opportunities, to actually connect them with live local job opportunities. What I'm going to do is after this call is just signpost you to where you can kind of access that information, so you can download the toolkit, see the strategy, see the type of content that we're talking about. It's all free of charge in terms of the strategy and the basic content, and that's the value of the hub. We want to help you and to deliver campaigns in your area by sharing costs. So there you go. There you see the social care recruitment hub. It's easy to get into. You'll see some of the assets there as well. All you need to do is register, and that'll give you access to the toolkit and the basic strategy and the content that we've developed, which you can use on the ground. And obviously, by talking to us and maybe talking to JP as well, we can help you to come up with a more precise targeting strategy to help you use that content and target the right people in your area in a way that's highly cost efficient. So that's the purpose of the hub. We're here to, as I say, share resources, not just from Westco, but from what other councils are doing to help you lower the cost of the campaign delivery and to optimize performance by sharing data to compare and contrast performance across different areas. So we hope you see the value of that in the coming weeks. We'll be holding these, what do you think, JP, about every 3 weeks? That's how the foster care recruitment hub works. You'll be seeing some of the assets that we've developed there as well. We also have another hub as well for COVID as well. So it showed the approach really does work, and we'll spend more time on this next time in terms of taking you through what's available to you. I know that some colleagues from a call we did a few weeks ago had cited this as well. So thank you very much. I hope you found that valuable. We'll send around links to where you can access information about what is available to you to help you recruit on the ground, and we'll see you in a few weeks' time. Thanks very much.